My name is Meredith. I am a reporter here with Delaware Online / The News Journal. I am joined by my colleague and former podmate, Marina, and we are going to be talking about a great series of stories that Marina published earlier this week, focusing on the racism and gaslighting that Black women in Delaware have experienced when it comes to their healthcare. So, Marina, first of all, can you just give a brief synopsis of your stories, but then also tell me a little bit about how this idea came up. I would love to learn more about the reporting process.
Sure. Hi, everyone. So this story, or this series of stories, is really just looking at some of the health disparities as it relates to Black women within our healthcare system here in Delaware. There's been a lot of instances of people feeling belittled, or people feeling like doctors don't believe their pain. And so this really takes a look at some of those stories and gives you a firsthand experience of what some of these women go through. It also talks about ways that you can advocate for yourself at the doctor's office. So I spoke to a lot of experts who gave some good tips and tricks that you can use, Black women or not. And so this story really started actually from Shamaya Gould, who is one of the first women that you read about in this story. She called me in like June, July, and told me about this experience. And I quickly realized that, this isn't unique to her. So I did a call out and the stories just came pouring in.
Yeah, it's really incredible. I'm also curious if you can talk about stories in the context of the pandemic. Of course, in a lot of the interviews, these women have experienced some levels of trauma for decades, things going back to them when they were just teenagers that still affect them. But I'm curious what your reporting showed about how Black women are being treated as this country and this state deals with a pandemic.
Right. So as the state deals with a pandemic, obviously there are a lot of issues when it comes to going to the doctor, and it's difficult to sort of get into the doctor's office and everything like that. And sort of once they get there, a lot of women have talked about, waiting a really long time, and then their doctor not being able to explain what's going on, or sort of rushing them out. So during this pandemic, when everyone is already feeling a little low, and then women get sick, right? And they have to go to the doctor, and this is added levels of stress. And that can have some pretty negative health outcomes for a lot of these women.
And something, again, was so powerful in these stories were, of course, any gaslighting or racism that occurs to anyone is shameful and awful. But you talked to several women who are in the healthcare field about their own experiences, specifically former Health Secretary Dr. Kara Odom Walker. Can you tell us about those interviews and what you learned from those who were experiencing racism in their own profession?
Right. So actually, a majority of the women that I spoke to were healthcare professionals themselves, either nurses or working with people in the community. And so it was interesting to hear them talk about, no matter what their station was, like Dr. Walker actually said in the story, no matter what their station was, no matter what their income bracket, whatever it was, they were still treated the same. And I think for one of the women in particular, it was incredibly heartbreaking because she works with Black women a lot every day. And, they would come in and tell these issues to her, and she would think, well, maybe they misunderstood, or maybe the doctor meant it in a different way. And then it suddenly happened to her, and she realized, no, this is what these women are going through. And she really changed her mind about it, and her perspective about it as well.
And something that I think is important for people who are watching to know is in Delaware, of course, across the country as well, but here in Delaware, Black maternal mortality and Black infant mortality are incredibly high and disproportionately affect Black women opposed to the rates of white women. And I'm curious, I believe you interviewed a couple doulas and midwives. Can you talk about what their roles are in terms of helping advocate for women in healthcare?
Yeah, so I'm actually working on a follow-up story right now about doulas and the importance of doulas and everything to a lot of Black women. Right now across the country and even here in Delaware, the maternal mortality rate for Black women is 2.5 times that of white women. And the infant mortality rate here in Delaware is even higher than the national average at, again, 2.5. And so these doulas and these midwives are there to advocate for a lot of these Black women. Because that rate is so high, having someone there to say, this woman is in pain, let's figure out what's going on, or to safely deliver her baby and also protect her, or all these things that I know a lot of women in the Black community here in Delaware really appreciate. And so that's sort of been their role. And so there's going to be a follow-up story specifically on that as well.
Can't wait. And I think it's also important for people to know is that I feel like when you hear the word doula or midwife, you're like, oh, what is this? What's this thing? When no, in fact, it is a licensed profession that requires training. So I think that's important. I'm sure you'll put that in your story that you should check out at DelawareOnline.com in the coming days. For those who haven't read your stories yet, can you give us an anecdote or two of something that just sticks with you that you reported in terms of what these women have experienced throughout their lifetime? Is there a couple stories that come to mind that you would mind sharing?
Yeah. So one of the big stories from this was Jonda Brown. She was 17 and she and her partner were going to have a baby. And she had gone to multiple doctor's appointments at that point and had heard her baby's heartbeat. And the one right before she had the baby that weekend, the nurse couldn't find the baby's heartbeat. It was a Friday afternoon and the doctor was like, or the nurse basically said, oh, let's just reschedule or something. But she was like, no, this is important. And so the nurse ended up telling her that they found the baby's heartbeat. It stuck with her because she didn't hear it herself. And so a couple of days later, she went into labor, and while she was going into labor, the doctors came up to her and basically said, we can't find the baby's heartbeat. And she delivered her baby who was dead, and it stuck with her. She was 17 in the 90s, and she now has 5 kids. And even to this day, that's something that still she doesn't talk about often. But those experiences are lasting. And it's not even just the crazy ones like that. You also have Cheyenne DeShields. She was in her early 20s, and she and her sister were in Newark, and they walked a mile to go to the bus stop. And they got on the bus. It was like, they got to the doctor's office. She had been having some thyroid problems. And she waited like an hour for her doctor, who then came in and saw her for 10 minutes and didn't prescribe anything. Basically said that other medicine that she had been taking that wasn't working, maybe she was nervous at the time, and basically like shoot her on her way. And from then, she actually had to experiment herself to figure out what was wrong with her. And she had to diagnose herself because she couldn't trust this doctor to actually help her. So there's, again, 7 women that I spoke to for this story. And they all have similar stories to that, where it has lasting health impacts, but it also has crazy mental health impacts as well. And as Dr. Walker says in the story, when women are treated like this over and over and over again, it has a negative impact on their health and their cortisol levels, which is the stress hormone. It rises. And so that can lead to cancer and other chronic illnesses. So yeah, there's a ton of those stories, and they just have lasting impacts on these women years later.
And something that I think isn't talked about enough is just the issues that I think specifically women suffer with chronic pain and feeling like they aren't being heard. I know that has affected my friends personally. Can you talk about that story that you wrote about tips for people to advocate for themselves? I'm curious if you had a couple that you didn't realize that appeared in your story.
Yeah. So I think that 3 of the biggest tips that these experts talked about were really to remember that when you go into a doctor's office, the doctor is working for you. It doesn't always feel that way because they're in a position of power and authority, but the doctor is there for you and you can take control of that appointment. So if they're explaining things too fast or they're trying to rush you, just remember, this is your appointment. And one of the experts said, like, you can even tell them, hey, I still have a lot of questions. If you can't answer them for me right now, when is a good time for me to come back so you can answer all of my questions? Because, again, they will be heard. And then another tip is just health literacy. Go online, be able to weigh yourself, measure yourself, do all of those simple things like read a food label so that when you go to the doctor's office, you can tell them what you've been doing already, the things that have been helping, haven't been helping. That will make an appointment so much easier for you and for the doctor. And write out your questions. After writing this story, I write out my questions whenever I go to the doctor's office, either on my phone or a piece of paper. It'll help you because when you get in there and you might feel frazzled, you can look down and do that. And then the last tip is just, if a doctor is not paying attention to your pain or belittling you or making you feel like you don't matter, go to another doctor. This is a competitive market. So find a doctor who will listen to you, and just stay strong until you can find someone who will listen to you.
And I'm curious what the reaction has been. I believe it's posted earlier Monday or Tuesday. What is time? But what has it been like? What did the women that you profiled, what did they have to say? I'm curious if your inbox has been flooded with similar stories. What have the past couple of days been like?
Well, it's been interesting because the women that I spoke to, a lot of them were just really excited that their stories were finally out, right? Again, as Black women, they were just so excited that someone was finally listening to them and putting their stories out because they know of their mothers, their sisters, their aunts, their daughters who have similar stories, and people might not necessarily believe them. So to put them all together and to have that, a lot of them were just really excited to have their stories out. And then, as you can see in a lot of comments and things, similar stories, very similar stories across the board. And, it's just been interesting because, like, you think that you're alone. A lot of these women, I think, felt very alone, but then they see that there's a ton of other people, and hopefully some change can be affected.
Yeah, and also I feel like I need to give a quick shout out to Jared Whalen, who did a beautiful design of the layout, to our photographers, Jerry, Bill, Jenna, for doing some beautiful portraits of these women. In a time where, like, doing photo assignments is much more complicated because of the era that we live in. So shout out to them. And just to end, what do you still want to explore with this topic? I would love for the opportunity for someone to be watching this and be able to get in contact with you. So what are the stories that you still want to tell related to just the issues that Black women face in their healthcare?
Yeah, so I still want to look into this issue of doulas and the importance of them, right? Like you said, sometimes when people hear that, they might not necessarily understand that this is a licensed professional. So I really want to look into those issues a lot more. And I want to see, just like, I would love to speak to more Black doctors and see how they are hoping to change the field. And these experts that I talked to in the story, they said that it's not just, the bedside doctors. There's a lot of behind the scenes stuff that can happen. And so I would love to speak to more of these healthcare professionals, or if you're out there and you see that someone is doing something really innovative to help with these health disparities throughout our state, let me know. I would love to hear more about that.
And Marina, how can people get in touch with you?
So you can simply look up my name, Marina Affo, Delaware Online. My phone number is there, and you can also shoot me a quick email. It's just MAFFO@Delaware Online, and my number is there as well. So you can call, text. I have my cell. Always looking for those stories.
Awesome. Well, I think that's it for us here. If you haven't already, definitely check out Marina's stories. They're all at DelawareOnline.com. And I really recommend that you subscribe to our work. Your investment allows Marina and me to ask hard questions, to write these really important and compelling stories. And this work matters. It makes a difference, like we talked about today. So that's it for us here. See you next time.